Hello, hi lovelies. Welcome to my channel. If this is your first time, please subscribe. Or if you know someone who may need this information, please let them know. Send them the links. Share. Prescribe. We're going to talk about the midwifery OSCEs. So we are going to start with what is comprised of the midwifery OSCEs. We go into the steps that are needed to be followed, and then we go into APIE that begins the stations. Okay, let's go right in. Let's not waste time. Thank you. Okay, just like we had said, we are going to try to understand what the OSCE is all about, what the midwifery OSCE is all about. So it's made of the APIE, and it's made of the skills stations. It's also made of the evidence-based practice stations and professional values. Okay, so as we know, the APIE stands for assessment. A stands for assessment, P stands for planning, I stands for implementation, and E stands for evaluation. Okay, so the first thing that you'll be given in the exam to do will be the APIE, because it leads you to the 4 stations that you're supposed to do, the first stations. So they'll give you one of the expected competences, and that may be either about antenatal admission, it might be about labor and birth, or a postnatal visit. Okay, so generally antenatal, the assessment will take you 20 minutes, the planning will take you 14 minutes, and the implementation will be 15 minutes, and evaluation is 8 minutes. That is for every station of the APIE, thus making the 4 first stations among your 10 stations. Okay, so what do I want you to understand here? That you should know what you are required to do in each of the antenatal, what is specific to antenatal. Okay, like in antenatal, you're not required to do a vaginal examination during your assessment. Okay, then we go to labor and birth, whereby you're required to do a vaginal examination. Then we go to a postnatal visit. So we shall be going into details of each and everything that you are required or expected to do at each of these stations in the coming videos. I'm going to go step by step. Okay, then we go down to the skills stations, what I expected to do. Sorry, I wrote on this paper because I was trying to streamline everything. So in the skills stations, we have the birth scenario 1, which is the shoulder dystocia. We have the birth scenario 2, which is PPH, postpartum hemorrhage. Then we have birth, which is like conducting labor. Okay, then we have complex birth, which is breech. Then we have the perinatal care, which is sepsis. I'll go to details with that. Then we have postnatal check. Sorry, it was postnatal care and then postnatal check. Then we have IV fluids and VIP score. We have IM injection. We have removal of a urinary catheter, and then the systematic physical examination of the newborn. We all know that with that we used a NIPE. The newborn NIPE stands for newborn and infant physical examination. It has a full screening program and everything that is available online. Those are guidelines that are approved according to research. Okay, so then we have our evidence-based stations, which are the place of birth, and induction of labor, you get one of those. So you have to go knowing the two of them. You'll be examined with one of them. Then you get to the professional values, which have bereavement care and then safeguarding women and children. Wow, okay, so some of these stations are silent stations, whereby you have to just write information from the scenarios that you're given, and I'm going to go into detail of each and every one. Write your comment in the comment section about something that you need details on. I'll be starting with this just to introduce what the topic is about, and then we are going to start with assessment. Assessment of antenatal, assessment of labor, and assessment of postnatal. Then we shall go to planning, we shall go to implementation, and then we shall go to evaluation. However, at every station, make sure you practice. Try it yourself, have some scenarios. If you need some scenarios, you feel free to comment here. I can inbox you and share with you some scenarios to practice on. Otherwise, there are practice mock materials on the websites, the exam websites, and on the IMC website. You can find them, okay? I'll be back. Let's do this. So let's continue. So let's go on and start with the antenatal APIE. So this is the assessment marking criteria for the antenatal APIE. One, the examiner will be reading through this as you're doing your practicals, okay? So you assess the scene for safety and privacy and dignity of the woman, which means you look around, see if there's nothing on the floor to make the woman sleep or you sleep during the procedure, okay? You clean hands with alcohol hand rub, washes with soap and water, dries with paper towels, following the WHO guidelines, and puts on disposable gloves and apron. You can find out how we do. There are 8 steps for the WHO hand washing, so you can go through that, or I'll also make a short video of how to do the hand wash according to the WHO guidelines, okay? Introduce yourself to the woman, name and stating role. Like you can say, my name is Nasuna Jamira and I'm your midwife for today, okay? Checks ID with the person. Person's name is essential and their date of birth or hospital number verbally against the wristband where appropriate, and documentation. So usually the patients are given white wristbands which have their names, date of birth, hospital number, and their NHS numbers. So that's what they mean. Then checks for allergies verbally and on wristband where appropriate. So you ask the lady, do you have any allergies you know of? Okay. Then if she has any allergies that are not written in her documents, make sure you provide her with a red wristband which is for allergies, stating the allergies she has, and make sure other staff get to know about it, okay? Then we check the review history. You confirm the situation, presenting symptoms. That is what the woman has come complaining of, okay? Then you check the parity, the gestation, presenting pain as appropriate. Remember, we have to, about pain, we have to score the pain. In midwifery, we use 0 to 3, 3 being the maximum, so you have to ask the lady, on the scale of 0 to 3, which one? How do you rate your pain, okay? Then she will tell you. Confirm background. Usually in the scenario that you're given, there is the mother's medical history, obstetric history, medication, also some family history or social history. So you make sure you check each and everything. I'll be going through everything. When I'm explaining to you the details, I'll go through everything. Gains consent and explains reason for assessment. Completes a full antenatal assessment. Verbalizes maternal observations, blood pressure, temperature, pulse, respirations, oxygen saturation, PV loss. Okay. Oh, okay. Yeah. Accurately performs observations to assess fetal well-being, that is abdominal palpation. Before abdominal palpation, you should do abdominal inspection. That is to see if the mother has trigravidarum, to see if there are any scars. Okay. Then there is auscultation for the fetal heart, fetal movements, and considers CTG, measures symphysiofundal height. Okay. Puts on disposable gloves and apron. Accurately performs urinalysis as per manufacturer's instructions. Yeah, but most times the scenarios have the urinalysis already done, so you have to ask your examiner for the results, okay? Then we have accurately performs urinalysis. Okay, that one is finished. Differentiates between fetal and maternal heart rate. You know how as you're taking the fetal heart rate using the PNAD, you also check with the maternal pulse on the wrist, okay? Then cleans hands with alcohol hand rub on washes with soap and water, dries with paper and towel, following WHO guidelines. We already talked about that. Accurately documents all maternal observations on Muse chart provided. I'll show you details of how to fill our Muse chart, okay? Assessing the well-being, clinical deterioration using a card. Identifies any observations that are cause of concern to the examiner, okay? Then let's go into details of how to go over this. Furthermore, we see that you have to accurately complete the Muse chart, signs, dates, date and time, monitoring frequency of assessment charts. Most times on your scenario, you'll be given the time. You assume the time that you're starting. They will write it for you. Then verbal communication is clear and appropriate. Uses calm voice. Speech is clear. Body language is open, and personal space is appropriate. Remember, you may be working with a mannequin or an actual person, so just keep in mind, do it as if you're doing it to a patient, like a normal patient in front of your live one. Acts professionally throughout the procedure in accordance with the NMC 2018 Code of Practice, Professional Standards, Practice and Behavior for Nurses, Midwives and Nursing Associates. Disposes of equipment appropriately. Verbalization accepted. Okay. Hey lovelies, welcome back to my channel, and this is your girl Sarah. So just as we said, today we're going to be looking at the APIE, and you're going to start. Greetings from my practice partner. What's your name? Okay, just as we say, the APIE has 4 stations, and that is the assessment, planning, implementation, and evaluation. So we're going to start with the antenatal assessment, okay? So let's start with the first one. Antenatal, you have to assess the scene for safety. Assess the room for slips, trips, falls. Then you say the scene is safe to approach, and then you continue. You clean your hands according to the WHO policy. And then you leave to dry for 30 seconds. I'll be doing a video of the WHO procedure on how to do the hand hygiene. It's 8 steps, so you can easily cram them. To do that, not cramming, practice. Just keep practicing. Oh, you already know them, definitely. So that is palm to palm, dorsum over dorsum, fingers interlaced, fingers interlocked. Thumb rotation, you do on each thumb. And then we have palm rotation. Then we have wrist rotation. Then we have fingertips. We have the fingertips actually before the wrist rotation. The wrist rotation is the last one. Then you rinse your hands and then you air dry for 30 seconds, okay? Privacy, ensure there's privacy, so close the curtains or any doors or windows that are open for privacy and dignity of the woman, okay? Then introduce yourself. What should we let's call our mother Jamila. Hi, Mommy Jamila. My name is Sarah. I'm going to be your midwife for today. Can I confirm your name and date of birth, please? The mother will go on to say. Then you ask, can I please confirm with your wristband? So you go to the wristband, confirm it's the same name and the date of birth and the hospital number. So then you confirm I have the right patient, okay? Go on and ask for allergies. Allergies, we will ask the mother if she knows of any allergies that she has. If she doesn't, so we shall continue. If the mother is allergic to anything, make sure you give her the red wristband for allergies, and write it in her notes. Inform other colleagues about the same, okay? Then you ask her what happens when she takes maybe that given drug that she's told you she has allergies to. Then you go on and ask the mother what's her name. Then you ask her what do you want to be called. Like if she's Jamila, then you ask her what name do you want to be called. They will tell you either what they want to be called, their name or any other pet name, okay? So then you ask for permission to go on, and then you ask her what brought you today. She'll go on and tell you the scenario, either pain or bleeding according to the scenario that you have. So that's the presenting complaint. The patient will explain to you everything in the scenario you have, okay? So you ask her, are you still in pain? If she says yes, then if I'm going to score your pain from the level of 0 to 3, with 3 being the maximum pain, how could you like me to rate your score, your pain score? Then make sure you document down what she tells you, or you keep it in mind, because you will need it further when you're doing your planning station, okay? And when you're also writing your final notes, okay? Or on the assessment station. Then you go on, so would you want some pain relief? She'll probably say yes. Then you say, okay, Mother Jamira, I'm going to do a series of observations and assessments on you. Once I'm done, I will make sure that I find the doctor to prescribe for you the pain relief, and will manage your condition. Are you happy for me to do that? Yes. If she gives you a go ahead, then you go on. Then you say, Jamira, I have, so let's name this, when you're now reviewing history after that. I have some history here in your notes. Would you like to review it with you? Okay, then you go on and review that history. Usually you're confirming something. So you'll go on from, can I confirm, maybe she had a cesarean, maybe she had a laparoscopy or something previously. So go on and read. Yeah, sorry. I was saying, so if anything the patient says contradicts with the history that you have on paper, make sure you correct it there and then, okay? Then we continue. So you're going to seek consent from the mother to do a set of observations. So you're going to explain to her, okay, okay, Jamira, here's what I'm going to do. I'm going to do a set of observations on you, which include temperature, blood pressure, oxygen saturation, respirations, pulse, capillary refill, and I'm going to palpate your abdomen and feel for the baby and measure your fundal height, measure your final height, find the position, presentation, descent. Are you happy for me to do that? Okay. So you tell the mother, here is a buzzer. Here is the buzzer. I'll go and bring my equipment for you. In case you need me, call me, okay? So I'll go and check my equipment if they're clean, safe, in date, and I confirm with the examiner. Can I confirm my equipment are safe to use, clean, safe, and in date, like well calibrated, okay? Then you go on to perform hand hygiene again. Put on gloves and put on your apron to start, okay? Mother Jamira, I'm back with my equipment. I'm going to start to do your blood pressure. At first, which arm could you prefer me to use? So she may tell you the right or the left arm. So you ask her, do you have any operations on your arms? She may say no or yes. Then you continue. Then you check both arms for any cannulation, any scars, any rashes, any swellings, because you couldn't want to use the arm that is affected because the mother will be uncomfortable, okay? Then you'll check the size to make sure the size that you have of the BP machine covers 80% of the patient's arm to enable you get the right blood pressure. Okay, then you put then I'll put the cuff, the blood pressure machine cuff around the arm 2 centimeters above the intercubital fossa. Okay, mommy, when I press the button, you're going to feel a little pressure on your arm. Please be calm and do not speak during the procedure. Is that okay? Yes. Oh my God, I'm being that. I'm trying to be that midwife and then the patient. Then I'm going to hold the thermometer 2 to 3. That's the temperature gun. 2 to 3 centimeters from your forehead and press the button. It will show me the temperature. It depends on the temperature machine, or they may give you the thermometer that you just need to add a probe, put in the mouth or put under arm, or they may give you the temperature gun. So whatever they give you, you utilize it, okay? What was I going to say? I was going to clarify the oxygen saturation, okay? Then you tell the mother, I'm going to check your pulse for 2 minutes. Those 2 minutes, you're counting the pulse and the respirations, okay? So you're going to check for the pulse by putting 2 fingers on the mother's wrist here, directly on the radial artery, and the respiratory rate by checking the chest movement. So then you can tell the mother, I apologize, I did not tell you when I'm during reading your pulse, I also did your respirations because it might change your breathing. And then we go on to ask the examiner, Madam Examiner, can I what is the reading of my observations? So when she tells them to you, you can write them down and then you ask them later when you're done, okay? So write them down. They'll give you a note in a paper where you're writing. So you write everything because you need them to fill your Muse chat. Okay, then we're going to explain to the mother that you're done with her maternal observations and everything seems to be normal. I'm happy to continue. Then you ask the mother, do you have any headache or visual disturbance? She'll say yes or no. Most times follow the answer that the mother tells you and do something about it. Don't ignore what the patient tells you, okay? Then if she says no, mother, I'm going to move on to your abdomen. Can I lift your blanket? Is it okay with you? Okay. This is gloves free. You don't do palpation with gloves, okay? So you perform hand hygiene again, okay? So you're going to assess the abdomen for any scar, any rashes, any wound. I can't see anything, so I'm happy to move on. Then I'll check the uterus fundal height with the tape. I'm going to, I was explaining about the fundal height. You hold with the tape which you put on the back of the fundus, the back from the fundus. This is the fundus to the symphysis pubis. Let's say on this door here, this is the fundus, and down here to the symphysis pubis. Okay. Well, this doll acts as the mother and the child. Oh my god. And show it to the examiner. Make sure the examiner is seeing every step you do. And you ask the examiner what is the fundal height. So she'll give you the details. Note them down, okay? Then you explain to the mother, I'm going to feel your abdomen for the lie, presentation, the back, the heart rate, and the fetal heart. Then I'm going to do what we call the Leopold's maneuvers. Okay. So the first one is the one facing the mother's face. And I'm going to feel for the top of the fundus. I don't know how to show this. Here. This is the Leopold's. So this one. Facing the mother's face, and to feel for the top of the fundus. For the baby, either for the baby's head or for the baby's bottom. So what you feel is what you write. You remember to ask the examiner where you do not sure. Okay. We all know the head feels hard and palatable. Okay, the bum feels soft, tiny, squishy, like it's palatable. It moves around like soft and all that. So. We're going to look at lie. We find whether it's a longitudinal or transverse. We looked at the baby's back, so we're gonna what do you find about the baby's back? Yeah, you palpate for the baby's back or palpate for the baby's toes, the limbs. So those who do not know the Leopold's maneuver, it's a maneuver that is used to palpate a gravid uterus systematically. What does this help? Step 1 is the fundal grip, determine the fundal height. Then 2, we have the umbilical grip, which is to locate the fetal back. Step 3, we have the Poquelin's grip, which is to identify the presenting part. Then step 4, we have the pelvic grip, which is to locate the fetal head. So your presentation may be cephalic, maybe breech, maybe oblique, maybe transverse. Off we go, 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 go. So after getting your findings, then we are going to go on to listen to the fetal heart rate by placing the pinad on the baby's backside. Where you feel to the back is where you place the pinad, and you listen to a complete 60 seconds. Simultaneously by checking with the mother's pulse. So as you're listening to the fetal heart rate, you're also corresponding it with the maternal pulse. Here are the radial artery with the 2 fingers, okay? Then you ask the examiner what is your fetal heart rate, because most times you're having a dummy, so you'll not be feeling anything. Don't assume. Ask the examiner what is my fetal heart rate. So according to the UK standards, it's 110 to 160. So she will tell you the figures, you write it down. Okay. Then you ask the mother, do you feel any fetal movements? Yes. Are you happy with the fetal movements? Make sure you ask the mother if she's happy with the fetal movements she feels. She'll tell you her answer and go on. Then you check the abdomen for contractions. By placing your hand on the mother's fundus, accessing the strength and duration of each contraction, and also the interval, which is from the beginning of the contraction to the end or beginning of another contraction. You're already midwife, so you know all that. Then you can also again ask her, tell me how is your pain? Where is it coming from? Like to know how she's feeling the contractions. Okay. Then you ask her, is it coming? And then, for example, in 10 minutes, how many times are you feeling the pain? That is, you're asking about pain for the contractions. Okay. That is if the mother is in labor. If she is not in labor, you don't need to ask this question. That is for only mothers who are in labor. Then you ask her, what is the baby's movement? Are you happy with them? We finished that, okay? Then we are going to go on vaginal loss. So after abdominal, we're going to vaginal loss. So you ask the mother, are you having any vaginal loss? By vaginal loss, we mean, are you having any bleeding or rupture of membranes? That's what we mean by vaginal loss, okay? So you ask, if yes, then you ask what's the color? When did it begin? Okay. What else? Okay. Yeah, if it's antenatal, you don't need to check. If the mother is having a pad, then you're going to ask her, when did she put on the pad? Are you happy for me to check the pad? Did you change it before? So basically that's it. If the mother has any bleeding during antenatal, that's it. You end at checking the pad. That's it for antenatal APIE, for antenatal assessment. Then we're going to go on to our planning. What else should I emphasize about assessment? I'm going to go back. I'm going to do the planning, and we continue. I'm going to then after the pad, after checking the mother's pad to see the amount of bleeding they have, then you're going to also go down to check the legs for any rashes, swelling, and redness. And then you're going to check the calf. Ask the mother if she has any pain in the calf muscles. That is to rule out VTE. And then you're going to tell the mother, thank you, I'm done with your assessment. And then depending on your findings, this and this, you're going to explain to her. Remember to give the mother results, what should I say, an explanation of what you've done. I would say you maybe have this and this, that's your provisional diagnosis, okay? So, and here I'm going to inform the doctor about this, and they will review you and will manage your condition. Are you happy with me doing that? Yes, remember to ask consent, okay? So sometimes in the scenario they've already provided you with a urine sample, sometimes they will tell you that it's already done, so you confirm with your examiner. Okay, if there is a urine sample, put on your PPE, put full PPE, and perform the urinalysis in the presence of the examiner. If it's not, then ask the examiner for the results. Then you go on to dispose your PPE, put in a new one, clean your hands, urinalysis. So in case you have to do the urinalysis, you have to make sure you check the name on the sample, check the date of birth and the date of the urine sample. Then you check your strips and make sure they are dry, in date, intact, and check the expiry date. Then you confirm to examiner you're happy to use both of them, the sample and the urine sticks, okay? Then you carefully open the urine sticks, open the sample bottle and dip the urine stick not more than 1 second, okay? Follow the manufacturer's guidelines, they'll all be clearly written there, and read the results to the examiner and the mother, write down. Then you dispose of your PPE. So you're done. Tell the mother anything you have to tell her about the urine, and send the urine to the lab for further investigations, okay? Thank you for watching the assessment. So the next thing we're going to do antenatal planning. Let's first do all the assessments. Let's finish assessment for all the stations, then we shall go on to do planning step by step. Thank you for watching. If you have any questions, please put them in the comment section, and if you need clarity about anything, I'll be happy to explain. Thank you. Bye. Ciao.